Okay. Hi, everyone. I'm Dr. Brad Bucklow, he, him pronouns, principal investigator and director of the University of Maryland Prevention Research Center. Thank you for participating in this UMD PRC webinar today. The UMD PRC is an academic public health research center focused on promoting mental health and wellness in LGBTQ plus populations, and it has a special focus on facilitating mental health provider competence for serving LGBTQ plus clients. And hopefully now you can see me. We thank our primary funder, the Centers for Disease Control and Prevention, and acknowledge that any opinions expressed today are strictly those of the presenters and may not represent those of our funders. Before we begin, I want to also acknowledge our UMD PRC faculty member, Hannah Trelka, for producing this event, and the UMD PRC Deputy Director, Dr. Jessica Fish, for serving as the discussion moderator. One last note, this session is being recorded. And now I'd like to introduce our esteemed featured speaker for today. Dr. Paul Poteat is an associate professor in the Department of Counseling, Developmental and Educational Psychology at Boston College. His research focuses on the school-based experiences of LGBTQ+ youth. With support from the National Institutes of Health and Institute of Education Sciences, his research on Gender-Sexuality Alliances has identified how these school-based extracurricular groups empower and promote resilience among youth from diverse sexual orientations and gender identities. Dr. Poteat has served as an associate editor for the Journal of Research on Adolescence and Counseling, Research on Adolescence, and the Counseling Psychologist, and he serves on the Equity and Justice Committee of the Society for Research in Child Development. So we're very happy to welcome Dr. Poteat.
Well, thank you for having me here. It's wonderful to be able to spend this hour with you all virtually, and I appreciate you generously giving your time to be with us. And I hope that what I'm able to share today will speak to some of what you're facing in your own work, whether that's directly on the ground and working in schools with children and youth, or as a policy advocate or a researcher. Really looking forward to sharing some of the research that my colleagues and I have been conducting over the past several years, and in particular during this most recent pandemic, and to have some really good discussion to follow on how we can take some of these data and really apply it and put it into direct use. So with that, to give some context to what I'd like to share with you today is to really first couch this conversation with the acknowledgement that we're currently facing multiple pandemics. Certainly the primacy of the COVID-19 pandemic is front and center for many of us. And at the same time, it's important to understand that this is occurring in addition to and in a confluence with many other historic and ongoing continuing pandemics. As many of you have probably heard or seen, we've also heard about the pandemic of racism that has been occurring in context with COVID-19 pandemic and historically, and as well with a number of ongoing crises. For example, for many LGBTQ plus youth, we can think about the history of bullying and harassment in schools and in communities as a pandemic and crisis. We see from continuing research from GLSEN with their biennial survey across the US, as well as with the CDC's YRBS survey tracking instances of bias-based harassment, that we continue to see that LGBTQ youth face significant bullying and harassment at school, and that while we do see some encouraging decreases over the past couple of decades, the disparities still remain and are very clear. I bring these up because in this current circumstance of the COVID-19 pandemic, that has the potential to magnify these historic and ongoing pandemics that LGBTQ youth face. And for example, just as some, we see that during COVID-19, we see racial, economic, and gender disparities in access to quality healthcare for those who have contracted COVID-19 and are seeking care during that time. And we also see a disproportionate impact of COVID-19 in communities, particularly communities of color. We also see that for LGBTQ youth, during that initial period where many of us were quarantined and needing to stay at home, a number of LGBTQ youth reported feeling the need to recloset during quarantine. It's important for many of us to remember that for LGBTQ youth, many may be selectively out to others in their lives. And so while they may be out to friends and peers at school or to adults who they trust at school, a number of LGBTQ youth are not out to their caregivers and others who are living with them. And so there's this strong tension and concern that for a number of those LGBTQ youth, while at home, they had to recloset in order to avoid any potential threats of violence or harassment from that setting as well. We also know that for LGBTQ youth, particularly youth who are in more rural settings or may have less access to resources in their own communities, a virtual space is often a place for them to seek a sense of support and connection with others in their lives. And in that sense, virtual spaces have strong potential for LGBTQ youth. At the same time, during this pandemic, there's also the potential to face harassment in those spaces, whether those are virtual spaces directly tied to the school context in terms of having a hybrid course or a fully online class that students in elementary, middle, or high school may be attending, and the potential for them to experience harassment there, or even outside of the school setting to experience harassment in those locations. And I bring these up not because these are necessarily new stressors that LGBTQ youth are facing, but to say that in this current circumstance, COVID-19 often can enhance some of these existing stressors. And that's something that we need to be aware of in terms of how we're able to provide support and resources to these youth. I'd also like to couch this in a bit of history that probably as many of us know on this call, that historically schools have played this critical role in meeting the needs of young people and their families in times of crisis. So not simply just during the COVID-19 pandemic, but during many natural disasters, for example. Many families and young people look to schools as a setting for them to seek out resources and food and connecting with healthcare providers. And it's also important for especially younger children to have a sense of routine, a sense of return to a normalcy, and being able to attend school and to have that in their lives. And so we often look to schools as one of the first places where we seek to see that return and to have access to those resources. At the same time, unfortunately and tragically, we've seen that during this current pandemic, schools have not received adequate resources, to put that as an understatement, to be able to meet these needs for so many people. At the same time, even as we look ahead to the future in terms of a widely available vaccine and eventual return to more consistent in-person learning, we have to recognize and prepare for the fact that for many youth, they'll be experiencing enduring trauma, whether, for example, they've lost a loved one to COVID-19 and are coping with that and processing that. We see that there will be years of economic ramifications for many children, youth, and families in terms of food and housing insecurity. and also having a limited access to other community resources that might have initially or originally been there. And while I know that that may have a heavy setting for this conversation, I want to balance that to say that although historically, when we've looked at LGBTQ youth's experiences in schools, we've seen schools as a source of stress or adversity for youth. It is so crucial for us to also recognize that at the same time, schools are a source of strength for LGBTQ youth. For many youth, that's where they connect with peers, where they connect with other adults, where they have role models that they can seek for support. And we can't lose that balance and that fact, because we find that for LGBTQ youth who report feeling supported in schools, they are resilient and they thrive when they have such support and feel affirmed. And so as we move forward through the remainder of this presentation, I want to highlight that part and talk about ways that we can really cultivate youth's strengths, draw from their existing strengths, empower youth, and ensure that through these times of adversities, we're able to promote their thriving and resilience. One way that we can do that is to look at a series of policies and practices that we can use and adapt and maintain in this present context of the pandemic. And so I'd like to go through some of these strategies that we can use and make use of during this time. We can think on one hand about some kind of clear, concrete policies and resources in schools that we know from existing research can be important in contributing to thriving and resilience for LGBTQ youth. The first one that I have listed here are enumerated protective policies. For a number of schools, they have anti-bullying and harassment policies, anti-discrimination policies that explicitly call out groups of youth who historically have been marginalized and experienced disproportionate victimization and discrimination in their school. And we see that for youth in those schools that have those enumerated policies, they report greater safety and well-being than youth in schools that don't have those enumerated protective policies. And I do want to emphasize the enumerated nature of these policies. GLSEN, which again I referenced a bit earlier as a national organization that conducts these biennial surveys with youth across the US, did a comparison, and they looked at youth in schools that had no protective policies around discrimination or bullying, youth that had were in schools that had protective policies, but they were rather general in their language and didn't name specific groups of marginalized youth. And they looked at youth in schools that had these enumerated policies, and they actually found that youth in schools that had these general policies without enumeration didn't look that much different from youth in schools that had no policies at all. And so it's really key that schools have these enumerated protective policies. We also want to give focus to having inclusive curricula. And by that, I mean a curricula that includes representation of LGBTQ plus individuals and issues faced within this community. Again, because that has also been shown to be linked to LGBTQ youth sense of safety and well-being at school. And this might be a little bit of a challenge again, as we're thinking about how to adapt potentially some of our existing curricula and policies to ensure that they remain relevant during this current context of COVID-19. So for example, if we're thinking back to the protective policies, how can we ensure that our policies also extend to and cover instances of harassment that may be virtual or during a virtual class session that we might not have thought about prior to this event? It's also important to have ongoing professional development around LGBTQ issues so that school personnel are aware of the current stressors and challenges, as well as the needs and interests for LGBTQ plus students in schools, some of the unique stressors that they may be facing, for example, in terms of around closeting or remaining connected to their peers and other adults at school during this time of physical distancing. And I also have down here LGBTQ plus affirming school clubs, which I'll go into a bit more detail in a moment. But in addition to those kind of concrete policies and resources within schools, we also have to give attention to relationships and interactions, which this current COVID-19 pandemic has really emphasized how crucial and important relationships and connections are to so many of us. And when we think about this, for example, now shifting to hybrid or online instruction, how do we go about methodically creating respectful and affirming norms and interactions in a virtual environment with class? How does that look similarly or differently in terms of that process compared to when it was in person? Because again, research shows that for youth who perceive a respectful and affirming classroom climate, they are also reporting lower instances of bias-based harassment. We also need to think about how to maintain those supportive adult connections with LGBTQ plus youth, again, while we have this ongoing physical distancing. The encouraging news is that a large majority of LGBTQ plus students report that there's at least one adult at school who they trust and can go to for support. And there's still a majority of students at school who can name 5, 6, or more adults at school who they can trust and go to for support. How do we maintain that during this current physical distancing, especially for those adults who may not be current teachers of those students? Students might be able to connect in some way formally with their current teachers, but for many LGBTQ plus students, their supportive adult relationship may be with other school personnel. So how can we make some deliberate approaches to make sure that those connections don't get lost during this prolonged period? And finally, how can schools also partner with LGBTQ affirming virtual or community groups that may be available to provide additional support? So I mentioned that I'd like to go into a little bit more detail about LGBTQ plus affirming school clubs, in part because that's the focus of much of the work that my colleagues and I have been pursuing over the past several years. And in particular, I'd like to talk about the role of Gender-Sexuality Alliances and how they can serve as a space during times of crisis, as well as in general to promote youth's thriving and well-being. One of the important reasons to focus on clubs and extracurricular groups in general is that there have been many, many studies that underscore the potential for these groups to promote healthy development for youth. The caveat is that most of these studies have given limited attention to LGBTQ plus youth. And so it's not as well known how well these groups may meet the needs and interests of LGBTQ plus youth. In relation to this, Gender-Sexuality Alliances could promote health and resilience. And as I'll show in a bit, there's been a significant increase in the number of GSAs across the US. And so there's high potential for GSAs to reach a large number of LGBTQ plus youth and allies in addressing their needs, their particular interests during this time. So some questions that might naturally arise for us may be, well, what do GSAs do? And how many are there? because that could give us a sense of how we could work with GSAs during this time. With regard to the first question, GSAs really serve a number of aims, and we can consider them as this setting where LGBTQ youth and ally youth can go to receive or provide social emotional support for their peers. It's also a place where they can access information and resources, especially information around LGBTQ issues, and to identify resources in the community, affirming health care providers, other LGBTQ community organizations that they might be able to become a part of. And they're also a place to engage in collective action and to address instances of discrimination within the school or even within the larger community. And so you can kind of think as GSAs as this space that can be quite dynamic and often is shaped by the particular interests of the youth who are members within them. And in respect to that, they're not, as we might consider, these standardized intervention programs where GSAs all look the same, because in fact, they can vary quite significantly from one another in terms of how much of an emphasis they may give for support relative to engaging in advocacy, for example. And oftentimes that's based on what the needs and goals of the current members may be. We've also seen most recently from CDC data that across all of the states in the US, on average, 38% of secondary schools in the US have a GSA or similar LGBTQ plus supportive club. So you can see just how expansive these clubs are across the US. There is admittedly some variability from state to state, as you might imagine. It ranges from, on the lower end, from 14% of secondary schools in Mississippi, all the way up to 72% of secondary schools in Rhode Island. And if you're curious about the percentage for your particular area or state, the CDC has a document where it lists every single state and District of Columbia, and you can kind of see just how expansive they may be in your area. Most of the initial research on GSAs was really addressing this fundamental question about access to GSAs and showing that GSA presence is connected with youth's well-being. Youth in schools with GSAs were reporting higher levels of safety and well-being than youth in schools without GSAs. And that was a really encouraging pattern and really has prompted us in terms of my colleagues and I to expand on that in a number of ways. Because while this is really informative, it also leaves a number of questions unanswered. For one, it doesn't really tell us why that might be the case. Why is it that youth in schools with GSAs may be showing so much better sense of safety and well-being? What is it that the GSAs may be doing that's actually contributing to this? We also are kind of left wondering, well, what are the mental health needs of GSA members? There's been some anecdotal discussion and informal discussion among practitioners and scholars about whether youth in GSAs are already naturally reporting greater well-being and showing strong resilience even before coming into the GSA, or if it's perhaps the opposite, where GSAs are actually there to serve the needs of youth who are most in need and are unable to access support through other outlets. And how may GSAs actually promote mental health among their members? Knowing that would help us to really refine the types of services we're able to offer to GSAs, the resources that we can offer so that we can really maximize their potential to be able to do what they're already naturally doing to help promote youth's mental health. So in a recent study that my colleagues and I conducted here in Massachusetts, we really purposefully sampled 38 schools across the state. And we worked with their GSAs as well as one classroom per grade level in that school to look at the mental health needs of youth in those classrooms as well as the GSAs. And we used some established measures of depression and anxiety. And we found that for students in the classrooms, about 35% of students in the classrooms met the threshold for probable mild depression. So on these assessment measures, there were some established cutoffs that would give you a clear sense that scoring above this level would indicate that someone is experiencing probable mild depression. And we see that in those classrooms across the 38 schools, 35% met that threshold. Now compare that to GSA members in those same schools, we see that 70% are meeting that threshold for probable mild depression. So we're starting to see that there are some clear needs for youth in GSAs that they could really benefit from having a strong set of resources to be delivered in this setting. We also see something similarly and even more markedly with regard to anxiety. 19% of students in classes across these 38 schools met threshold for moderate or concerning levels of anxiety. And in contrast, for youth in GSAs in those same schools, we're seeing levels at 62%. So clear demonstrable needs. I put that up because, again, in thinking about how the current COVID-19 pandemic could magnify the needs of youth, and in particular, the needs of youth in GSAs, we then conducted some interviews with 10 GSA advisors in Massachusetts as well as California to try to understand what were some of those initial challenges that their GSAs face whenever the pandemic was causing those first disruptions and folks were switching to a remote classroom learning. What we found was evidence of some of those concerns that I raised at the very beginning of the talk. So for example, one of the most significant challenges that GSAs faced during the initial pandemic were issues of privacy, that many youth in GSAs, again, are not necessarily out to their caregivers, other family members. And so this shift to even virtual GSA meetings was something that led to many youth having feeling excluded and unable to participate in. There were also difficulties with member retention. There was initially very high interest and need for having virtual GSA meetings, but over time, a number of GSAs saw their membership kind of start to dissipate. And perhaps linked to that, advisors noted that it was a bit of a struggle to make virtual meetings engaging. So wanting to join, I think we can all, that resonates for many of us in terms of the many Zoom meetings that we have with colleagues and having work meetings. We've noticed just how important those 3 minutes before a meeting and 3 minutes after a meeting are for informal connection and discussion with friends and having some side conversations that's very difficult to emulate in Zoom or other platforms. There is also a difficulty to now balance discussion across so many issues. Again, we were facing a host of stressors and pandemics. And ultimately, this took a high toll for students in the GSA who were graduating seniors. There are many kind of annual events that many youth look forward to in terms of participating in the GSA, and even as we look ahead to graduation. And this was a particular sense of loss for those youth in GSAs. And as we are all very well aware, virtual school was stressful for students and advisors. And it's very difficult to have the psychological energy to attend classes staring at a screen all day and then expect to do the same for an extracurricular club. It just couldn't be the same for many GSAs. And there were very real challenges with connectivity and being able to learn how to use all of these new online platforms that made it challenging for youth and advisors to be able to hold regular sessions. But out of those challenges, I think what is encouraging and so hopeful are all of the creative ways that advisors and youth took on these challenges and adapted. And I think I'll lay out some of these here, but for those who are interested in more, I can't take any credit for the creativity of this brief, but several members of our team made this brief to kind of summarize some of the challenges and ways of addressing those challenges. And we'd be happy to share this with anyone interested. I'll have my email available at the end, but we see that they were very creative in finding new ways for the GSA to connect, bringing in alumni for alumni panels, which might not have been possible in the past, but capitalizing on the virtual opportunities, being able to honor their seniors in some way, by having rainbow tassels and dropping them off at their homes was just very touching and important for youth. Being able to connect outside of the GSA informally is another thing that many youth did without the advisor being involved. And then GSAs are a place to discuss multiple forms of oppression in addition to sexual orientation and gender identity. And so there was much discussion about instances of racism and xenophobia within GSAs that were occurring during this same time, and able to receive support for youth who are experiencing multiple forms of oppression concurrently. And so in thinking about those stressors that many youth are experiencing in GSAs during the current COVID-19 pandemic, as well as long before the COVID-19 pandemic, we were interested in looking at how GSA engagement might predict reduced mental health concerns. And we wanted to see whether being more actively engaged in and participating in GSAs could ultimately, over the course of the school year, lead to reduced mental health concerns. And we know that GSAs themselves are not a formal therapeutic setting or intended to serve as, a formal group counseling experience. However, in drawing on the aims of GSAs to really foster the strengths and build on the strengths of youth, we expected that nevertheless, GSAs could promote better mental health through a process of empowerment. And I'm sure that many of us on this call have a sense of what empowerment is, but it's a very abstract construct. And when we're thinking about broad abstract constructs, especially with me in a psychology background and training, it can help if we can kind of break that down into smaller pieces, and that makes it more easily able for us to work and build it. And so from the psychological literature, when we think about the nature of empowerment, what empowerment constitutes is a gained sense of self-confidence, a sense of agency, ability to act, feeling like one can act, feeling a sense of control and power, such as empowerment, and feeling able to kind of set your goals and to be able to achieve your goals. If we start to break it down like that, then we can start to get a sense, a little bit better visual sense of what empowerment might look like. And we can look at it even more so in terms of the types of empowerment that one might like to cultivate. You can think about relational empowerment, emotional empowerment, cognitive empowerment, and behavioral empowerment. I list relational empowerment first because actually when doing work with youth, relational empowerment often is seen as most important for them. And for them, relational empowerment really constitutes this sense of solidarity with peers, this ability to mutually support one another through their own struggles, their shared struggles, their different struggles, and to be able to promote other peers' ability to have a sense of agency and control. And so I really want to emphasize that as something that we need to attend to. In the context of our study, we looked at empowerment in terms of a sense of validation from peers, a sense of efficacy to promote social justice, and finally, a sense of hope. And what we found was that youth who were more actively engaged in their GSA over the course of the school year later reported relative increases in a sense of validation from peers, sense of efficacy to promote social justice in their communities, and a greater sense of hope. And I would argue that these in and of themselves are worthy, critical outcomes that show just the necessity of GSAs and their potential in promoting well-being for youth. But in addition to this, we also found that a sense of hope uniquely contributed to a relative reduction in depressive symptoms as well as anxiety symptoms at the end of the year. And crucially, we found that there was a significant connection between GSA engagement and mental health through this increased sense of hope. And so through hope, GSA engagement predicted lower depressive and anxiety symptoms. So I want to pause here for a moment to think about hope, similar to how we thought about empowerment, because again, when we think about empowerment and hope, these are admittedly somewhat abstract concepts, and if we can make them a bit more concrete, then we can act even more readily upon them. And when we think about hope, sometimes we might think about hope in a passive sense, in terms of a passive sense of positivity for the future. But I really want to look more deeply, again, perhaps from the psychology literature, about how hope is conceptualized and seen. And when we look in that literature, hope tends to be defined in a much more active sense. Hope is this belief that you're able to pursue and achieve your goals. There's this focus on a process as well as an outcome associated with that, and that you have the knowledge of how to pursue and achieve these goals. So having a hope means I have a clear sense of a goal or an outcome that I want to see. And not only that, not only do I see this outcome in the future that I want, but I can also see the pathways to get there. I can see where I'm at and how I can go about getting to that goal. And I feel a sense of confidence and ability to be able to pursue one of those paths to achieve that outcome. And I think that that's an important place for us to begin in our work with youth, is in cultivating hope. And by having this definition, I think it highlights some initial ways that we can go about that in our roles as adults and working with youth. Whether this is in GSAs or outside of GSAs, in schools or outside of schools, seeing this connection with hope, I think highlights how we can partner with LGBTQ youth to work with them to identify what are their goals. It could be a short-term goal of something that they'd like to achieve this week, something that might be even longer term by the end of this school year, or even longer than that. But what might those goals be? How can we generate a list of goals and really clarify what those are and identify why those are important to us and why we want to elevate them in our lives? But not to just end there, but then to illuminate pathways, multiple pathways to achieve a goal. Not just having one option, but multiple options, by seeing that I'd like to graduate by the end of this school year. What are some pathways to get to that point? And essentially, how do we serve as a source of support and a resource to work with and alongside them in amplifying their abilities to engage in those actions? So I think that that's a place for us to be able to use some of this work and put it to direct use. It's a place where we're starting in our own group to think about what we can work with GSAs in terms of creating resources and materials to really help to enhance this naturally occurring process of promoting hope and empowerment within GSAs. How can we magnify that within those settings? That's something that we're taking from our work. I hope that will be of use for how you might be able to work with youth in your roles, as well as in thinking back to some of those other strategies outside of GSAs, but also within schools. I hope that this has been helpful. So for more information, if you'd like to receive any resources that we might have, or we can connect you to other LGBTQ plus youth serving organizations, please feel free to reach out to me. I'll be happy to connect. But I'll pause here and would be happy to take questions or engage in any kind of discussion that we might be able to have within this virtual environment.
Wonderful. Thanks so much, Dr. Poteat. We're just so grateful to have you here and for you to share what you're learning kind of in the moment when working with GSAs and young people. I just wanted to very quickly, well, first, let me not be a disembodied voice. Here we go. Hi, everyone. So just I want to cue your attention to, we have had a couple of questions pop up while you've been speaking. You do have access to the Q&A window, correct?
Let me see if I can pull it. I haven't been able to see any while I was presenting, but I'll pull this up.
Yeah, some of them, I think they're great questions. Some of the questions, and I have some additional questions as well. So for those of you who are attending, please feel free to open up that Q&A button and to put in some questions for Dr. Poteat to answer, and hopefully we can get some discussion going here. Do let me know if you can access that, Dr. Poteat.
Sure. So I've got them. I see open, I see answered and dismissed. So I'll just focus on the open questions for now, and I'll try my best to make my way down here. But I see Jordan has a question. What suggestions do you have for states or districts to incorporate GSAs into their schools? What barriers do you see in this incorporation? I appreciate this question, especially because when we think about GSAs in schools, we might naturally tend to think that GSAs are in schools that in general are already affirming and supportive of GSAs. In fact, when we think about clubs in general, we often think of any school administration or district administration as being supportive of having clubs. Who wouldn't want to have clubs for youth to be able to have a more one-on-one relationship with an adult who's advising that club or other peers? And yet, when we think about GSAs and even more broadly about clubs that are oriented around promoting social justice or calling out discrimination, whether that's interpersonal discrimination or discrimination at an institutional level, we do see that GSAs are in schools and in school districts that face a degree of pushback and hostility. And we've worked with some of those GSAs, and we see how the lack of support from principals or other administrators at the district level does hamper so much of what they can do. And so we especially see that in those schools, GSAs take a much more inward focus in terms of working with members around providing social emotional support, and that other advocacy and awareness raising efforts tend to be much more restricted, because for some of those you have to secure permission from administrators to be able to do some sorts of awareness raising campaigns or other larger scale efforts. But in some ways it depends on your state and state policies around clubs and clubs being permitted. So it's a little bit difficult to answer without a state-specific kind of understanding of what their rules and regulations might be. But I would say that in general, taking kind of a hopeful and positive approach, GSAs tend to be very much youth-led and adult-supported. And so oftentimes, GSAs are most successful whenever they're really driven by youth. And it tends to be where there will be a group of youth who are very passionate and dedicated and want to have a club like this. And they'll then seek out a teacher or other adult at school who they believe will be supportive to sponsor their club and to be able to start it and then to build momentum. Many GSAs range in size. GSAs can range from 2 members, 3 members, all the way up to 40, 50. I've had conversations with folks in Florida who have GSAs in auditoriums of over 150 students. But it really is, it can be as many as 2 or 3 students. And that space is absolutely vital for those students. So I hope that that provides a little bit of information in terms of how GSAs can look and how they might be able to be initially started. If you go to glisten.org, they actually have a number of resources available for how to start GSAs and how to kind of help build them up. So I would certainly look to those as well. And I have a question, looks like a more technical question, might be an anonymous researcher here. When you selected classes, did you pick a certain subject? Were they standard level classes or advanced classes? We really tried to work primarily with English classes in each of those grade levels. We tried to select classes that would be open or required of all students in that grade level so that we'd have as kind of broad representation as possible. And let's see. Michelle, oh, it's so nice of you to join. So what distinguishes hope from future orientation, or are the, oh, something just popped. Oh, here we go. Or are they one and the same? Well, I think that's really good to highlight how in psychology we do have a little bit of a problem with construct overlap. And oftentimes we talk about constructs with different names that are really honing in on the same thing. I would say in a lot of ways, future orientation may be similar enough to hope. I think that hope tends to resonate for a number of young people and adults, and it's kind of in our common vocabulary. And so I wouldn't try to necessarily tease them apart, but I think really I think for all intents and purposes and practice issues to really think about some of those key components about being able to orient towards future goals, identify how there might be pathways to those goals, and feeling really equipped and supported to be able to pursue them, and having support from adults and peers as they go through that process. And I see Jordan has another question here. Based on your model, you tie 3 outcomes to GSA engagement. Are these outcomes based on membership and engagement in GSAs, or are they moderated by the types of programs offered within a particular GSA? I think that's a good question. If I understand your question correctly, it's asking a little bit more about some of the specific things that you did in the GSA, or just their overall kind of engagement. And for this particular focus in the study that I presented here, we looked at just active engagement in general. So for example, attending more frequently GSA meetings, contributing to discussions in those meetings, helping to plan events or activities, and talking with advisors or peers. And we looked at that in relation to these outcomes. In some other work that we've done in analyses, we have been able to tie that to specific kind of practices and experiences in GSA. So we were able to look at how receiving more social emotional support in the GSA is related to hope and other indicators of well-being, as well as receiving information and resources and engaging in advocacy. And in another study that we conducted, we found in particular that receiving more information and resources and engaging in advocacy really buffered against the negative effects of discrimination on well-being. So we find that there are these particular practices and experiences that can also be tied. And oh, Charlotte, it's so nice. You're also so kind to be on this call. Let me see, when you ask about their goals in context of GSAs, what are some kind of things you hear about? I think that this is something that we would love to look at more closely. In the study that we conducted, it was primarily quantitative in thinking about hope. And so goals was kind of broadly conceived and presented so that it could be applicable to youth more broadly. But I would love for us in the future to be thinking about and working with youth to see what are some of those common goals that youth and GSAs may have. What are some of the unique goals that some students may have? Because if GSAs can know that and perhaps dialogue with youth, even in the beginning of the year, to talk about what might be some of our collective goals as a group that we'd like to pursue over the course of this current school year. I think that could be really helpful in galvanizing a lot of youth members to contribute to that and have a shared sense of supporting one another. And it would also be important for GSA advisors and youth leaders and GSAs to know what some of the unique goals for some members may be so that they don't feel lost or invisible within the group. Let's see, it says, so many studies, another anonymous attendee, so many studies on the mental health of SGM youth seem to focus on negative outcomes, anxiety and depression. Given the importance of hope that you've spoken about, do you have any recommendations for how to nudge research in this field towards more widespread inclusion of hope, resilience, and positive mental health outcomes? I hear this and it really resonates with me. I think in our ability to link the two together is one way to help convince some groups to think more broadly about health and wellness beyond kind of our standard indicators and that tend to be focused on deficits like anxiety and depression, but to show that there's also a clear link to these other positive indicators such as hope and resilience, and to really emphasize that these outcomes of hope and resilience are important to youth. I think that will be able to convince some people who may not already be on our side to really think about these. I think we want to be able to show that there is this needed balance, because as we saw in some of our initial data, a large majority of youth in GSAs are facing these clear needs around anxiety and depression. How do we address those and attend to those and support youth? How do we provide kind of connections to the community or referrals to healthcare providers who might be able to work with them intensively around depression and anxiety, while also recognizing that these youth come with incredible strengths and a passion? And how do we cultivate that and not lose out on that and build that and really develop a whole person approach to our work with youth? And Heidi, your question, is the study available in addition to the slides? Yes, I'd be happy to share a copy of the full study publication. It just came out recently in 2020. So please feel free to email me and I'll be happy to send you a PDF of that. And final question, it seems, will the slides for this webinar be shared? I'll defer to Jessica on that, but I'll of course be happy to share them. You'll see after this slide of the any questions slide, I have a couple of slides of references and resources so that you can click on some of those links and it'll take you to a number of LGBTQ plus supportive organizations that are local as well as national that would be able to provide some additional resources. So I hope you'll check those out as well.
Great, and just to add some clarification, we will be posting the slides and some these resources somewhere on our UMD PRC webpage for you all to access at some point. And maybe we can find a way to email everyone who attended today with that information, because it seems like a lot of folks are interested in getting this information that they're going to find that they're finding so helpful. So thanks for sharing those, Dr. Poteat.
Oh, and I just saw a one additional question. Is the MoCo or MOCO Pride Center on your list of resources? No, I'll have to look at that. I know that a number of the we have a number of national resources as well as some that are more specific to Massachusetts and California, simply because that's where most of the work that we've done has been located. And with all of the research that we do, we make sure to maintain our partnerships with those GSAs. And so with the study that I presented, it was part of a much larger project. And with those GSAs we worked with, we had an ongoing series of briefs so that in the following school year, every month we sent out a 3 to 4 page brief that kind of carved out a part of that project and gave them a tailored report of how their GSA might have responded relative to the larger groups of GSAs. And we included some conversation starters to kind of generate some conversation around that particular topic that we highlighted, and we gave them a list of resources in the community. But we would hope to do the same with GSAs in other parts of the country. But unfortunately, since we didn't work in Montgomery County, we don't have any resources there, but I'm always curious to be able to build my own knowledge of what resources may be out there. So I'll definitely look into that.
Great. Well, I think we might have time for one more question if someone wants to try and sneak someone in. But while we're waiting on that, I just wanted to say thank you so much, Dr. Poteat, for coming and sharing your work with us. It's been great to have you. And I know that I've been receiving messages from folks who are just really excited to be able to hear about this work. So thank you so much for taking the time to talk with us.
Oh, thank you. It's really, truly been a pleasure. And I guess I would just round out to say that while we focus on GSAs in this presentation and how we acknowledge how important GSAs are, really there's a larger network of resources within schools, GSAs being one of them. And we really need to think about how GSAs can operate in concert with having an inclusive curricula within classrooms and having enumerated policies, because if we have all of those things working together are what are really important to be able to promote resilience for youth, not only in the GSA, but within the school more broadly.
Fantastic. Yeah, thank you for that reminder. So we will be doing our best to get this information out to everyone. This will conclude the webinar for today. Please look on our website to find the slides and potentially the recording, which will be posted soon. And always you can contact Dr. Poteat via email if you have any follow-up questions. Thanks again, Dr. Poteat.
Thank you, everyone.